1,000 views on the adverts on Facebook. There's around 10 of you, 12 of you here, so I really do appreciate you guys being here. You're doing better than 99% of the population already just by being here. Okay? Each and every single one of you has to take the time out of your day, out of this very beautiful Saturday, to be here to learn about your body. Maybe reschedule something, left a loved one at home to really better your health. So thank you. And we do a few of these different talks. Before I start, I just want to make sure I'm talking about the right thing. Is this the fibromyalgia talk? Oh, amazing. Right. Now, the reason why I wanted to do a talk on fibromyalgia, we do this once every 3 months or so. The reason why I wanted to do this topic is because I see on a daily basis with patients that come in with fibromyalgia as to how much misinformation and misguidance there is relating to the diagnosis. I can't tell you how many times one of my patients has been diagnosed with fibromyalgia, but then they ask me what it actually means for them. And that is why I want you guys to make the most out of this next 45 minutes, maybe an hour if I start rambling on, to really give you a much better understanding as to what is happening. Okay? However, if I only spoke at you, you would not remember very much. Hence, is it okay if I ask for a favor? I'll ask you guys for a bit of energy, a bit of interaction. It will make it a lot more fun, you'll get a lot more out of it. Here's your first piece of research for the day. There is a lot of high quality studies that show us you actually learn better when you're awake than when you're asleep. So let's try and stay awake for this topic. Okay? Very high quality research, very high quality research. I won't expect much, however I was always told that the rules of conversation apply even in a health talk or presentation. Similarly, if you guys ask me a question, I'll do my absolute best to answer it. I'll ask the same from you guys. If I ask a question, I might ask for a hands up, a thumbs up, or some ideas to be shouted out. We'll make it a lot more interactive, a lot more engaging, and a lot more fun. Is that okay? Yes. I'll also ask you guys to keep an open mind, especially with fibromyalgia. It's a very emotional topic. I know a lot of people carry a lot of emotions with it. Some people fought very hard to get this diagnosis, and I want to make it clear from the start that I'm not here to prove or disprove any of the research that you guys have done, any past experiences you've had, because each and every single one of you will have a little bit of differences in that. I'm simply here to give you the information based on my knowledge, research, facts, and everything I've experienced here in the clinic to give you a better understanding as to what's happening. Is that okay? But I do want to make it clear that if you were an appointment with a GP or a specialist and you were told that, well, you have these symptoms, but when they look at the scans and the blood tests and everything looks normal, so there's no cause, that you're not alone. I hear it often. And there is a cause to your symptoms, and it is real. However, if somebody doesn't know how to look for the issues, then they won't find it. It's not something that shows up on blood tests or MRIs. Okay? And like I said, it is a very personal topic, so I'll ask for more personalized questions to get us to the end. I'll be the last person to leave this building today. I'll leave once all the questions have been answered. Is that okay? Just to make sure that I stick on track, because I have a very big tendency of losing my train of thought. Because I really want to make sure you guys make the most out of this next.
Have you got faster then? I don't want to make you actually like that.
Potentially, maybe a bit of ADHD, but I didn't get tested for it. I want to make sure that I really do get everything across to you guys, okay? Yes, exactly. And we'll cover that as well, though. There is a lot of waiting times as well, okay? And that is why I want you guys to make the most out of this. So let's start nice and simple. Who here has fibromyalgia? Okay. Who here has widespread pains around the body? Okay. Who here has fatigue? Chronic fatigue. Chronic fatigue. Difficulty sleeping, insomnia, digestive issues. Who here won't put their hand up no matter what I say? Usually there's somebody who doesn't put their hand up, actually everyone puts their hand up. So, we'll talk about fibromyalgia, but when I was planning this talk, I was thinking about what can I do to really maximize your time with me? What can I give you to make sure you absolutely get the most out of this talk? And I realized something. That I'd likely be the first health practitioner talking to you about health as somebody who's not part of the National Health Services, the NHS. So is it okay if I weave in a little bit about health itself and then tie it all back to fibromyalgia to give you a much better understanding as to what's happening? Is that okay? Mm-hmm. Yeah? Amazing. First, now I don't know about you guys, but who has been to a very boring talk before? I went to university, I had to pay for that stuff. It's not nice. So if I ever go to a talk, I want to make sure I know who's talking. Hence, I'll introduce myself, okay? My name is Oskar. I'm a chiropractor here at Complete Health, one of 3 chiropractors. Amongst the 3 of us, we see around 1,000 patient visits a month. I've been in this clinic now for almost a year now. It's been an absolute great time. I would say that this is easily one of the more rewarding jobs out there. I had the pleasure of working with people of various ages, various conditions, and although everybody's different, I have one very simple rule with everybody. Because yes, they are different, but I have one clear goal. Any ideas as to what that could be? It's to get better. My main goal is to get them doing the things that they love, with the people that they love whenever they can. It's not to make them feel good, because let's be honest, life is a lot more fun when you get to do the things that you want to be doing on a daily basis. Whether that's spending time with your grandkids, playing with your family, doing your hobby sports, or work if you need to. And feel a little bit of soreness after, compared to sitting in a corner all day with it. See what I mean? And that is why, lost my train of thought, that's the first one. Yes, and that is my main goal with our patients. Now, does anybody know how long a chiropractor has to stay to become a chiropractor? Any ideas?
7 years?
Yes, thank God no. It's 4 or 5 years, yeah, it's 4 or 5 years. So, I would need a pretty good reason why to become a chiropractor, to spend that much time studying, and to be in as much student debt as I am right now. Is it okay if I tell you my reason why I became a chiropractor? So you're going to stand a bit above my morals and values as to what I stand behind. Is that okay? So my reason why I became a chiropractor is my mother. Now, she's not a chiropractor. She's not a health practitioner at all. My mother has been written off, so she's unable to work. And it was her experience through the NHS that kind of pushed me away from that path. I used to want to be a doctor. I used to be the cool guy wearing the big lab coats and the stethoscopes. I thought it was so cool. But it was actually her experience that kind of pushed me away from that path. And it wasn't that somebody was doing a bad job. It just seemed like nobody really wanted to interest themselves in her. They saw her as a ball of symptoms rather than a person. And I had front row seats with that. From the age of 5 or 6, I had to go to appointments with my mum and translate everything from English to Polish and Polish to English, because we're Polish by origin. So it was her experience that kind of pushed me away from the path. And I'm sure some of you will be able to relate to that as well. Where you have a scan, then wait 6 months to see a specialist, and then get referred to another scan for another test. Each of it around 6 to 8 months, maybe even a year and a half's wait in between, where you feel like you're getting nowhere, and nobody's really wanting to help you. And that is why I looked to other areas. And actually chiropractic allowed me to do something very special. It was to work with the patients when they hit rock bottom, and I say rock bottom because usually people come and see us as a last resort, and work with them to get them to where they want to be. Not just being somebody on the other side of the desk, giving you a magic pill to make you feel good. Actually working with you to get you where you want to be doing. Not just feeling good, but actually doing the things that you want to be doing. And that is why I became a chiropractor. Now, through all these experiences with my mum, she was prescribed many things onto opioids, and after several years of opioid usage and irritating her bowels, she developed bowel cancer. Now she's cancer-free now, which is amazing. I always say if I were to have a heart attack or cancer, I'd have it in the UK. The NHS is amazing when it comes to those things. They are absolutely amazing when it comes to cancer treatment. They take great care of my mum, and they're amazing when it comes to emergencies. However, we can all agree that they really do struggle when it comes to complex body pains. Things like fibromyalgia or any sort of pains. We see it all the time. That's why people come and see us instead of waiting the extra year and a half to see a specialist. We see it all the time. And that is why I am here on this Saturday, to give you the opportunity of learning about your health and learning about your body. Because I know people want to learn about their body, not just getting out of pain, but to actually improve their function. In the sense that I preach the idea of preventative healthcare, not just taking care of the body in its pain. You don't brush your teeth just when you have a toothache. The body deserves the same treatment. I talk about how preventive healthcare is actually more efficient and more cost effective than simply taking care of the body when it's in pain. It's proven by research, where people who take care of their health on a regular basis live a high quality of life and for longer. And research actually shows that probably 30 to 40% of appointments, GP appointments, could be cancelled out if people took a proactive approach to their health. Hence, I am here talking about it. It brings me to the idea as to what health actually is. Because I'm sure some people, actually, if I were to say, what is health? Can you guys shout some ideas out at me? You know, if you think to a healthy person.
Physical, spiritual.
Yeah, well, yeah, right. It's, yeah, so the actual definition of health by the World Health Organization goes like so. Full physical, mental, and social well-being, not just the absence of pain. So can we all agree that simply not being in pain doesn't mean you're healthy? Because things can be brewing that will lead you to that point, even though they are not painful yet. Does that make sense? And it brings me to the idea of the quote. I love this quote. I love it so much that I wrote it on our wall. It says, "The doctor of the future will give no medication, but will interest his patients in the care of the human frame, diet, and in the cause and prevention of disease. A true doctor will not just give you a magic pill to make you feel good, he will work alongside you to get you to where you want to be. To get you doing the things that you love. Spending time with your family, playing with your grandkids."
Fortunately, most doctors don't have your view, because they just want to throw you on pills, get rid of you. That's how you feel.
Yeah.
Sometimes.
And they will have 15 minutes.
Yeah. And it comes to the fact that the NHS is very stressed out in the sense that they don't have enough budget to deal with everything. Hence, they simply want to get people in and out as quick as they can, giving them something. And understand, it's a very hard job. There's actually a lot of research that shows us that GPs themselves realize that they don't have enough time to assess people properly before they make a prescription. It said probably around 60% of GPs don't have enough time, claim they don't have enough time to actually physically diagnose somebody before giving a prescription. And that is why people come and see us, because they actually see the benefits of not only taking care of the body to get out of pain, but functioning better as well. And that is why we're talking about it here. So if we actually center down into the ideas as to what makes a person healthy, if you think of a healthy person, what are some things that a healthy person would do?
Exercise.
Exercise, yes. There's 4 main pillars. Exercise is one of them.
Balanced diet.
Diet, correct. Yeah. Exercise, diet,
Sleep.
good sleep. Oh, you guys got all of them, my God. Because there's one more which nobody gets ever, but those are the 3 main ones.
Would
Congratulations.
it be your mental health?
Mental health, I would say that's a result of everything that we'll be talking about. So, sorry? I'd put down the diet as well. I'll go on to what the 4th pillar is, but if I center it down, exercise, yes, it's crucial. Exercise has a huge correlation with our physical, mental and social well-being as well. It is said that if you take, I think, between 9 and 10,000 steps a day, you reduce your chance of death due to all causes of mortality by around 15%. You literally prolong your life, decrease your chance of dying from any causes by 50%. You decrease your chance of developing heart diseases by around 30% as well, simply by moving enough. Do you guys know when we see the biggest plummet in health in patients with things like neurological conditions like multiple sclerosis or post-stroke?
When they are not able to move.
Correct, yeah. Once they are not able to move properly, that is when their health plummets more significantly. It was a really interesting study. And I make it clear that exercise doesn't have to be like going to the gym or anything. It can be simple as walking. And the study that is really interesting, it was done on mice. It was 2 groups of mice. What they did was they assessed the mice's ability to create new neurons in their brain, basically assessing brain health. One group could move freely, the other group had their back legs strapped in. And they assessed how that ability to create new neurons changed. How much do you think that decreased in the group that couldn't move correctly, percentage-wise? 50? 80?
70.
70? It was 60%. 60% reduction in brain health because they couldn't move properly. And we see similar things in human beings as well. So over a longer period of time, if we're not getting the right amount of exercise in, that will have an effect on the body completely. So exercise is a crucial thing. We talk about diet. Everybody knows the saying, you are what you eat. If you eat well and fuel your body really well, you will generally have a lot more energy and feel better. Now, I'm sure all of us at one point had a really heavy full English breakfast and felt very sluggish until probably around 3 p.m. in the afternoon. I know I've been. It has a huge effect on how well you function. Here is a morbid fact for you guys. Actually, let me ask you this. Would you guys say that the quality of food has increased or decreased over the last 50 years?
Decreased.
Decreased. The amount of processed foods that we eat, was that increased or decreased? Increased. Do you guys know how much microplastics an average human consumes on a yearly basis? It's about the size of a credit card. Would that have an effect on our body?
Yes.
Completely. Completely. Yeah. On the body from head to toe. So diet is a crucial thing. going to talk about. And then sleep. You said sleep. Sleep. I'm currently reading a book on why we sleep. I don't know if anybody has read the book Why We Sleep. It's a really interesting book. It says, well, generally males should sleep between 7 to 8 hours. Females actually between 9 and 10 hours a night to fully recover. I know. Good excuse to stay in bed.
So
I'd stay with the kids.
Good
I tell my wife that.
Yeah. It's a good excuse to have a lay on something.
But she hasn't worked yet.
Yes. So interestingly, as you get older, you sleep longer, but your quality decreases. And the right duration and quality of sleep is crucial for your health. It's said that also, if you get the right amount of sleep with a high enough quality, you reduce your chance of developing things like cancer and heart disease. Sleep is crucial. It is quite literally when our body recovers. Yeah, we talked about how most people struggle here with sleeping, so insomnia. And we'll go a little bit deeper in that as we go throughout the talk. Okay? So we talk about exercise, we talk about diet, and we talked about sleep. All crucial areas. Now there's one more pillar, one that most people don't think about, but actually a lot of research was done into it. And it's actually a fully functioning nervous system. A fully functioning nervous system will support all the three other pillars. So the nervous system is basically the brain and the nerves that come out of it. If you want to exercise, your nervous system has to allow you to do so. The nerves go to the muscles and create motion. If you want to be able to sleep correctly, our body has to be able to calm down to enter sleep. That is also the function of the nervous system. Similarly, with digestion, your body needs to be able to calm itself down to enter the rest and digest state. It's crucial. And if we center it to three main functions of the nervous system, does anybody know what those functions are? I already hinted at a little bit what I just said. Any ideas? Yeah. Movement.
Everything.
Everything. If you could specify a little bit more.
It's about the movement, it's about what you want to do, like I'm doing right now, and as to breathe or your heart really beats, so you don't
Yeah,
think about
correct,
it. It's about the interconnection between the hormones in your brain
Correct.
as well, and
So yeah, actually covered everything there correctly. So we
and the
had,
mental and the spiritual ones.
yes. So you said movements, we had sensation, sensation, and then you had things that you don't think about. So movement, like we said, we need to engage our muscles through the nerves. We also have sensation. What do we say most people in this room have? Pain. Pain is when the nerves and the sensation doesn't work the way it's meant to. It's not just pain, it's also be able to feel your body in space, how you're moving, and that will get affected when the body's not working correctly. So we have sensation, we have movement, and we have the autonomic functions. So like I said, the ability to fall asleep, the ability to digest, these are things you don't think about. I'm sure everybody in here has had breakfast or lunch by now, but you're not actively thinking about putting it through your mouth. That's everything that we don't think about. Now that's what happens when the body works the way that it should. But does the body always work the way that it should? No, it does not. And there are several reasons as to why a body wouldn't work the way that it should. In chiropractic, we call them the 3 T's. Basically, it's 3 different types of trauma. If I were to tell you, give me an example of a trauma, what would you tell me?
Physical as a car.
Yeah. So physical is one of them, yes. Physical is one of them. Physical, I would say, is the easiest one to separate into the 2 categories. You have big occasional traumas. That can be things like a road traffic accident, a surgery, anything that is a one-off big event. And then you have small repetitive things. So all of us, I assume, worked in the past or are working. Most jobs will fit either in prolonged sitting at a desk or a manual labor. Prolonged sitting at the desk will put a stress on your body. That is a physical stress. It is said that the pressure on the discs in the body increases by around 50% when you sit down. But then also you have the other half of the population that will be working a very physical job. Everybody knows how to lift and bend over correctly, but let me tell you, I see a lot of builders and construction workers, and they know, but they don't do it. So all these things over the years add up. I call it like a compounding effect. Do it one time, not a problem, but do it over weeks, years, decades, and then we get issues. Does that make sense? So we have physical traumas. Any other ideas? Yeah, mental traumas. Mental traumas is a huge one as well. That can also be separated into large events, occasional ones. For example, a passing. Recently, it was probably around half a year ago now, my dog passed away. My dog that I grew up with all my entire life, basically, and I wasn't physically hurt, yet my body felt slow, it felt sluggish, I felt anxious, I was very alert, just didn't feel right. I felt achy, even though generally I feel quite fine. But then you also have the small repetitive things, whether it's relationship traumas, things that you experience on a daily basis, stressful environments at work or in life. All these things have an effect on our body, completely. And there's one more. So we have physical, we have emotional, there's one more.
Social environmental
Environmental. So what did you say?
degeneration.
Generation. I would say degeneration is actually the result of all these stresses in the body. I would say you are correct, the environmental stresses. It goes back to the point I said previously, food quality up or down in the last 50 years? Down. Is the air quality better or worse?
Worse.
Worse. Do you guys know what the prevalence of cancer was around 10 years ago? 1 in how many people? It was 1 in 3 people 10 years ago. Do you guys know what it is now?
1 in 2.
1 in 2. Did we change at all as human beings within the last 10 years? No. We haven't actually changed much as human beings within the last hundreds of thousands of years.
Quality of life's gone down, hasn't it? Across the board, really.
Yeah.
And stress has gone up because of high
Amazing.
bills and things like that.
Amazing.
Great
Great answer.
correlation.
Yeah. And it goes to the whole idea. I heard a gentleman in front, our last talk said, well, isn't there like a genetic predisposition to these things, like for example developing diseases? And yes, however, genes only express themselves if you put them in the right environment. If you put it in a very stressful environment, all those genetic predispositions that will lead to issues become active. Hence, we didn't change much as human beings, but our environment significantly has. The air that we breathe, about radiation, that is we are exposed to, and everything on a daily basis that will have an effect on our body. Does that make sense?
Yeah, also, and I don't know, sorry, I don't know in which category you put this, but for example, we are seeing more and more allergies result of in the 70s and 80s. You would take antibiotics for absolutely anything. And that is also making that the younger generations and our generation is.
That's where the superbugs have come from, isn't it?
Sorry?
That's where all these superbugs have come from, like
Yeah.
MRSA, because they're just over-medicating us.
And we lose our defenses.
So over-medication is one thing. Allergies would be another thing that would be related to the nervous system. Because hormonal control and endocrine control, so everything to do with actual biomarkers in our body, all relates to the nervous system as well. It will still be relating to the fact that, as a whole, we live in a more stressful environment as human beings than we did 50 years ago. That's why we see a rise in conditions, several conditions, which we'll actually cover in a bit more detail. So we talked about different types of traumas. And now I'll deep dive into as to how these traumas will actually have an effect on your body. And I have a very great story that Andrea loves, because it always, she hates it, I say it all the time. It involves a tiger. A tiger is basically a large stimulus. It will be the equivalent of all the stresses you experience on a daily basis. But for this one, we'll use a tiger. Has anybody been to the zoo? Yeah, did you see the tiger there? I thought there wasn't a tiger in the zoo. There's no tiger in the zoo. No, there's no
What's your I've seen tigers in zoos.
Okay, but there's not one in Drusilla Zoo. But for this one,
okay.
yes,
No,
in Drusilla Zoo. My
No,
apologies.
sorry.
Let's imagine there is a tiger in Drusilla Zoo.
Okay.
It hopped on a train from Drusilla Zoo and it got off at Eastbourne train station, okay? It's walking up Gilders Road. It walks past Poppy Seed Bakery because it's not feeling like getting a sandwich or anything. It sees Complete Health doing a health talk on fibromyalgia with 15 beautiful people and thinks, I'm going to have very nice breakfast. So it walks up the stairs, opens one door, opens the other door, and it stands right there. All of us look at the tiger. What do we do in that moment?
Fight or flight mode.
Fight or flight mode. We scream, we freeze, hopefully not freeze. But you run. You enter the fight or flight mode. Correct. In that moment, when we see that tiger right in front of us, what happens to our heart rate? What happens to our blood pressure? What happens to our blood sugar levels?
Those.
What did you say?
Those.
Lows. So it actually goes up. It goes up. Reason being, your blood will try and get the sugar to your muscles so you can run.
Okay.
That's actually how it works. What happens to our cholesterol levels in that moment? Anybody knows?
Goes up.
It goes up as well. It's part of the stress response. Cholesterol is a fatty molecule that goes into the blood, that thickens the blood. It gets released into the blood to prevent you from bleeding out. Similar to the similar functions of platelets. In that moment, we said we're in fight or flight mode. What happens to our muscle tension? Tenses up. You've got to protect yourself. Anybody here has a dog? Yeah. When the fireworks go off, what do?
It depends. I've got 3 rescue dogs. One of them shits itself, and the other saying, "I'm not bothered."
And that's a response as well, I guess you could say. Generally what I was getting at is that usually people start curling up. That is, when a dog is scared, it tucks its head. Yeah, what does it do to its tail? It tucks it back as well, right? Same thing a human does. It's a normal response. You start protecting your vital organs, you start doing this. In that moment, we're in that fight or flight mode. What do you think happens to our ability to digest? Stops. Your body doesn't care about your breakfast. There's a tiger in the room, of course. What happens to our body's ability to fall asleep? Doesn't exist. There's no point, right? What happens to things like, let's talk about sleep. Oh yes, only 2 things: sleep and then digestion. The stress response is a very good thing in the short term. The problem is that because of the stresses on a regular basis, the bodies, especially people who are diagnosed with fibromyalgia, we get stuck in that fight or flight response. There's a lot of research now coming out. It's something that actually as chiropractors we've been talking for a very long time. I would say within the last 10-15 years, there's a lot more studies talking about things like sympathetic dominance, chronic stress response, syndromes, stuff like that. What basically implies that there's not actually a pathology in your body. There's not something that you can see on an MRI or a blood test, but the body's simply not working the way that it should because it's overly stressed. That makes sense. Now, most of us don't have a tiger in our room, obviously, but we do have repetitive stresses throughout life. And it's actually really interesting that when you compare these changes in the body to some of the conditions that are on the rise. So we talked about blood pressure going up, right? Hypertension on the rise. We talked about blood sugar levels skyrocketing. Diabetes, also on the rise. High cholesterol, heart disease, also on the rise, where the bodies are just simply not working the way that they should. Things like IBS, Crohn's, on the rise as well. I actually did a bit of research. Every single year there's just more diagnoses, and that's also accounted for the fact that there's more people living. There's more diagnoses being made. Things like IBS, Crohn's, and then things like insomnia, chronic fatigue syndromes, because like I said, whereas the majority of our healing and recovery done? Only sleep. Exactly so. So I personally make it clear that these are not conditions that you can catch out on the street. Somebody doesn't sneeze at you and you catch fibromyalgia or chronic heart disease. These are things that are developed over many, many years from the body simply not working the way it should. Yes, you have genetic predisposition, but the fact that the environment around us is so difficult, it makes these things flourish. Does that make sense? And especially if we tie those changes of the stress response, fight or flight mode, to the symptoms of fibromyalgia. One of the main ones, most of you put your hand for this, was the widespread pain, right? Widespread pain. When you're stuck in that fight or flight mode, do you think you become more alert and more sensitive and more perceptive of those potentially painful things? Yeah, it's your way of surviving. You want to perceive all those changes. The best way I can describe widespread pain, because obviously you guys know there's nothing actually wrong with, like, structurally. We've had this talk how on an X-ray or an MRI, you wouldn't be able to see those changes very well. It wouldn't diagnose your issues. However, the best way I can explain it is with a volume dial. Because you're stuck in that stress response over a long period of time, your volume dial is to the max, basically. Where now every single little signal throughout your body is perceived as painful. Even simple things like touch. That's why sometimes somebody touching can feel painful. A simple hug can feel painful. That is completely normal. And it's very common. The body usually is very good at filtering out what it's meant to process and what it's not. But because we're stuck in a fight or flight response, every little thing goes to your brain to be processed. Does that make sense? As to why you can feel pain even though there's theoretically nothing wrong in the area. Doesn't mean there's no issue, but there's no actual pathology or actual fracturing. That's what I mean. Does that make sense? Amazing. And it also makes sense with that approach as to, another thing is you get widespread pain, but you also get shifting pains, where one day, for example, your shoulder may hurt, and then your knee may hurt another day, and then your low back. And it doesn't really make sense as to why one thing would have more on one day than the other. When you get all these informations from all around the body, do you think the brain gets better at mapping out where that pain is coming from, or worse? Worse. It's overloaded. It's tired and it's overloaded. Which goes on to my next point, which is another common symptom of fatigue, chronic fatigue. We talked about how now the brain is really struggling to filter out what's relevant and what's not relevant. It's processing everything. best way to describe it is the use of a conveyor belt. Usually, the conveyor belt is filled in an amount that the brain can deal with it. But now the brain cannot filter out what it's meant to deal with when it's not. Everything goes on the conveyor belt. Everything. Another analogy is having a basket that is overflowing. Every single thing on that conveyor belt has to be processed by the brain. Everything. It's working overtime. Would that be tiring? Yeah, would be tiring. Now the body is stressed. It's overworking throughout the day. But thank God people with fibromyalgia sleep very well so they can recover at night, right?
2 hours a night.
Exactly. So not only are you overworking and overprocessing during the day, when you then go to sleep at night, your body is not able to calm itself down to get you sleeping in the right quality and the right quantity. You overdo, you under-recover, you overdo, you under-recover. You do that over days, weeks, years, decades, and we get some serious chronic fatigue, where the body is never able to really heal itself and recover. Does that make sense? Another huge thing that is related to fatigue is actually something that we track heavily in the clinic here, and it's with posture. Posture, we talked about how people start curling up when they're in stress response. I mean, if you just look at Gilbert Road, if you have a board having a coffee, just look how people walk. Most people will be stooping over or having some form of limp. An imbalanced body cannot work efficiently. We see that, and I think we have some handouts. Andrew, do we have handouts? Because we track posture here before we start treatment and after. Most people will have imbalances sideways or forwards and backwards. Do you think that would use more energy to move or less energy to move? More. You're not moving efficiently. That is why people with fibromyalgia usually will go for a short walk and feel drained. Absolutely drained. So you can go for a short 10-minute, 15-minute walk and still feel absolutely fatigued because your body is simply not working efficiently. So simple movements require extra energy. However, it's something that we track, and actually once we start working with the body to get it working the way that it should, the body starts to function in a much better state. We see those changes. So the key areas of fatigue will be excessive processing, due to not being able to filter out the information, but then also postural imbalances. Postural imbalances and muscle tension will then also predispose you to develop further issues.
So is there a recommended way to sleep?
To sleep.
Yeah, so front, flat, side.
So especially with situations like this, I'll say the answer is a lot more difficult because it wouldn't be stemming from the position sleeping. It'd be stemming from the fact that your system isn't working the way it should. So it's not lack of comfort, it's your body on a biological, like microbiological level not being able to calm down. And that is a lot more difficult to explain and get on top of than simply sleep on your side instead of your back. Does that make sense? And plus that'll be individual.
Just because you say about posture, so if you've got pain and sleeping a certain way eases that pain,
Yeah.
your posture's not good, is it?
Yeah. And it goes to the, yes, exactly. And that's why people develop postural issues, because you will get a small pain, but then if you do this, it doesn't hurt as much.
Yeah.
But then you start walking around like this now.
My
You don't have
posture
further
is
issues.
horrendous now. Never used to.
Most people will have some level of issues. And to get the full answer to that question, like the full analysis will be had. Because people can have similar pains, but to different pains.
The thing is with posture as well, when you talk like next, I'm 6'7", and you know I'm ridiculously tall, and you know getting in and out of cars and things like that, you know, finding clothes and things, just everything, you know, because not many people are my height. So.
Yeah, and that will have an effect on the body. Hence, posture is a crucial thing, especially for fatigue. So we talk about widespread pain, shifting pains, fatigue, and insomnia. How difficulty sleeping will just make the cycle even worse. You can never really recover.
So do you have trouble
With
sleeping?
posture.
I get 2 hours a night if that. I bottom run, I get a full night, but it's not proper sleep, is it?
I don't know, apnea.
Hmm?
Apnea. Do you snore?
Do I snore?
Please.
And another one is brain fog. So anybody experience brain fog here as well? Yeah. We talk about how the brain is going to be extremely stressed out and overworked. Do you think that will help or hinder our cognitive functions? Thinking. That's going to annoy, obviously. The brain is tired of dealing with everything. It's going to even more so struggle to deal with active thinking. Okay? Now we talked about how the stressed out nervous system will lead to these symptoms. However, I'll give you the actual play-by-play as to how this develops. Okay? So if you actually understand this, you'll understand how you actually develop these nerve irritations and how that will stress out the entire system over time, causing you symptoms. Okay? So we talked about how stresses have an effect on our body, whether physical, emotional, or environmental. That will then affect our nervous system. The tension on the nervous system will cause imbalances in our body, the way that we hold ourselves in posture. As a result of that, some areas of our body will not be moving the way that they should, because we're off kilter, we're not standing the way that we should. If an area doesn't move the way that it should, that causes local inflammation, and that inflammation will be irritating the nerve. Have that in several areas throughout the entire body. Now the entire system is irritated, we get symptoms of pain, fatigue, insomnia, where the body is simply stuck in that irritated state because it's irritated at so many different levels. Does that make sense? That's the play-by-play. It's very, very simple. But then it gets to the point of, if we were to simply focus on the symptoms, are we dealing with the cause? Who here has, anybody has been prescribed anything for their fibromyalgia medication?
Oxy, I've been on cocodamol,
Mhm.
diclofenac, pretty much every painkiller out there.
Yeah.
I was only diagnosed 2 weeks ago, and my symptoms started 13 years ago.
Yeah. Most people will be on some form of neurodepressant, some form of anti-inflammatory, or a painkiller. And I have a really good analogy as to why that doesn't really make sense in your case. I use the rubber band. I actually learned it over the weekend, and it's an amazing analogy, because it will explain to you as to what's happening in the body and how potentially we can actually sort this out, and why a neurodepressant and a painkiller may not help. So, we have imbalances in the body. Now we have areas of the body that are compressed. Irritated nerves. So imagine this is a nerve. There is quite clearly an issue here. My finger, if I leave this for maybe 30 seconds, I won't have an issue. But if I leave it for 30 minutes, my finger will go black. It will fall off. Okay. It will fall off. Similar, as we talked about with the bodies, how if one day you experience a bit of stress, it's okay. However, if you do it on a regular basis for many years, then the issues stack up and we get symptoms. Now, what can I do to take the pressure off this region to get it working the way that it should again? Any ideas? Sorry?
Cut the band.
Cut the band. That makes sense, right? Obviously take the band. I could take a painkiller, right? I could take a painkiller and I could numb the pain and I wouldn't be aware that I would have a band around my thing. Around the neck. I could also take an anti-inflammatory drug. It would minimize the amount of inflammation on the tip of my finger, generally making it feel a little bit better. I could also take a neurodepressant, which would numb the signals of pain from this region so I don't perceive the pain. But would that actually fix my issue? No. So what was the common sense thing to do? Take the band off, right? It makes sense. Yet, interestingly, when it comes to body aches, people will still take the approach of taking neurodepressants, painkillers, which simply focuses on the end, the symptoms. And we can't expect long-term changes unless we actually deal with everything before that leads to it. Does that make sense? So then it becomes a question, am I going to come back to you? Then it becomes a question as to what can we do to actually create the change? And it goes to
Just remove that from your finger.
I will. It's a tension. I'm about to do it. It's like the big punchline.
Building up the suspense.
I'll cover it if you like. The question is.
I cannot look at this and I cannot listen to you slowly.
Okay. And the question is, what does a chiropractor do?
Posture.
Long story short, basically, yes. We talked about how those stresses and imbalances will put inflammation into your joint region, which will irritate the nerves. The chiropractor's job is to find those imbalances throughout the body, the ones that are relating to your symptoms, and to put motion back into the joints to take the pressure off the nerve. Basically, taking the band off my black finger. That's what it is. But what does the healing? You guys. I take the pressure off. I take the band off. But it's your body that does the healing. The same power that grows your hair, that beats your heart, the same power that heals your paper cuts. It's as simple as when the body works the way that it should, it's able to heal itself. Simple as. Life is stressful. And we are able to take the pressure off the system to get it working the way that it should. That's what a chiropractor is. Because when now an area moves the way that it should, there's no inflammation, the nerves are not irritated, and the system is able to regulate itself, get out of the irritated states of the stress response. Does that make sense? Makes sense, right? Taking the pressure off the nervous system.
What's the process?
Sorry?
What's the process exactly?
I'll go over that as well. But that's basically, long story short, as to what a chiropractor would do. Because you can understand how that story, that play-by-play, leads to the symptoms. Taking a painkiller or a neurodepressant will simply numb the pains down. However, we want to actually change the process. Yes.
Okay, so you spoke about the inflammation. In this context, not just the fibromyalgia,
Mhm.
the neurological and the protein storm, what are your thoughts on when you have the inflammation sitting there in the spinal cord, where you have such a big inflammation? Do you think there's a potential? Is there a way this inflammation can I won't say migrate because I don't have the vocabulary, but if there was a word for me to use, it would be migrate to
Disappear?
another
Oh.
part of the body that has nothing to do with where you saw that inflammation right there in the scan.
So the point being is, we can see how the nerves, we talk about how the nervous system controls absolutely everything in the body. Everything. A nerve goes to absolutely every single end of your body. If there is irritation somewhere in the nerve, we'll be able to find it. Whether it's in the spine or somewhere else in the body, completely. My goal isn't to get it to migrate, it's to get it to be able to resolve itself, to answer your question. So whether it's in the spine, that's basically the home of the nervous system. Most issues will be stemming from it. But the good news is we can assess the entire body, so if there is an issue somewhere, we'll find it. And I make it clear that these issues that you're experiencing are not something that is visible on an MRI or a blood test. Anything that may be slightly elevated will be inflammatory markers. And unless somebody knows how to find these issues, you won't find them. And if somebody knows how to actually address the issues, no long-term change will be present. And we take great pride. I'm okay to just do questions at the end now, because I will lose my train of thought. Appreciate it. As I said, I will stick around to answer all the questions. What's my train of thought?
And you have brain fogs.
Sorry, you got fibro.
Brain fog.
You're talking about the spine connects everything.
Yeah, spine connects everything, and I'm basically talking about how, remember at the start when we did the questioning about who has what symptoms? All of you, well, to some extent, have been diagnosed with fibromyalgia, or have been exposed to fibromyalgia. Yeah, every single one of you have different symptoms. You can't find an MRI, you can't find them in a blood test. Unless somebody knows how to find these issues, they won't find it. And that is why we take great pride in this clinic here, at least, because we work so closely to the nervous system in the approach that we take to treat people, to create those changes in a safe and gentle manner to get the body working better. Our approach is very, very simple. We do a full neurological assessment to actually figure out what is going on. And like I said, you now understand the major premise as to what is causing your symptoms. But do you think all these imbalances will be absolutely identical in every single one of you? No. Each and every single one of you have lived different lives, experienced different traumas, and have different wants, needs, and aspirations. So would it make sense for me to treat all of you exactly the same way? No, you do. Now you understand the premise, but to actually figure out exactly where those individualized changes are, we need to do a full examination. And that will differ from patient to patient. Now we see big changes, and I already hinted at the fact that chiropractic can be beneficial with patients with fibromyalgia. We have great pride in the sense that we treat a lot of people with things like multiple sclerosis, neurodiversity, fibromyalgia, cerebral palsy. I treat gentlemen with cerebral palsy because our approach is so centered around the nervous system. Our goal is simple: get the body working better. I never claim to be treating fibromyalgia. I never claim to be treating cerebral palsy. I'd probably be struck off the register for that. I simply make sure the body is working as best as I can get it. So naturally, if the body works the way that it should, people feel better. 3 months ago, we had somebody sitting in the exact same chairs that you are sitting in right now, Ms. Melissa. She was diagnosed with fibromyalgia 8 years ago. She was listening to the exact same talk that I'm doing right now. And she understood what I was talking about, really resonated with my message, and she decided to join as a new patient to get the full consultation to see what's going on. We started working together, and she came in with several widespread pains throughout her body. She had a weird tingling sensation throughout her entire body, and she was also struggling with sleep, chronic fatigue. Now she is able to once again enjoy her life on a much higher quality. Her pain levels have reduced, she's able to sleep much better, and more important for her, she can actually do more activities with the children she takes care of at her workplace. She is able to go for longer walks. That's the most important thing for her, because her body's working better. That's as simple as that. But it's a matter of finding out what those issues are with you. But don't take my word for it, we see that in research as well, where patients with fibromyalgia with chiropractic care do see changes in reduction in pain, but also improvements in movement, range of motion, and general quality of life because they're able to move better. Fun thing is, not just in the short term, also in the long term. Because like I said, it's not just dealing with the symptoms, it's dealing with the play-by-play changes.
Because all the things that are creating it are still going on, though, aren't they? The stresses and the environment. So is it just learning as well to manage those better?
I mean, I wish I could say, don't live a stressful life.
That'd be nice.
I'll be trying that as well.
I mean,
Don't worry about it.
I say to people, I mean, I can't, you have to keep working, you have to do what you've got to keep doing. The environment around us is generally stressful. And yes, if that isn't taken care of over many years, that's going to accumulate and cause issues. Generally, what we can do is make sure improve the body, because we can see the improvements with our testing and posture scans and functional testing that we do with our neurological assessments, and then simply look to stabilize it. Because if we get the body working better and then give you things to do to stabilize those changes last.
You know what's bad with the NHS at the moment? Now, rheumatology is the only department that should be diagnosing it, and they are now refusing to see anybody with fibros symptoms.
Yeah.
So it's now being passed back to GPs who are not even trained.
Does anybody know what the actual criteria is for diagnosing fibromyalgia?
Yeah, we've ruled out everything else, so.
Isn't that
That's,
what
that's exactly it.
Yeah.
13 years being poked on it, lip cut
It's
open,
markers or
spine
something like
shape.
that?
It's actually quite simple. So it's generally a diagnosis of exclusion. Correct. Basically, you don't fit any other category and you have a lot of pains, you have fibromyalgia. The actual criteria is you have 5 or more pains throughout the body that don't seem to be related. It doesn't take any scans, anything fancy, any blood tests, it's actually diagnosed. And I feel like that's a very big, not downgrade, but you're downplaying it a lot as to what's actually going on in the body. There is clearly a cause, and the whole premise of fibromyalgia is that you have pain in the body without a cause. Fibro means tissue, myalgia means painful. Tissue sites. Yeah, painful tissues, which, I mean, that's a fancy word for something your body has. Does that make sense? The good thing is we can actually change that process of getting the body working better, in the sense that you get those long-term changes where you can actually live a high quality of life. And I talked about, I'm going to take questions in, and I talked about how we can create those changes here. And let's be honest, guys, you're not here to just hear me ramble on about this. You're here to potentially have an opportunity to get this problem sorted out. It's something that my mother didn't have, and I want you guys to have the opportunity. So is it okay if I briefly talk about what that initial consultation may look like here in this clinic, so we can actually discuss how to get you fully assessed, so we can pick up those individualized changes in your body to then guide the treatment after. Is that okay? Right. So here in the clinic, it's a 2-day procedure. On the first day, you come in and ask a bunch of questions. Trying to figure out what's going on, how long has it been an issue for you, and what were your goals, needs, and aspirations, and everything in the past regarding traumas, to give me a very good understanding as to what's happening. I assess it from head to toe. We talked about how these things don't show up on an MRI or a blood test. We take great pride in the sense that we know how to analyze the body in a much deeper way to find those issues by assessing you hands-on. So we do a full examination of your neurology, from head to toe, so I know exactly where those issues are. If necessary, we can take an X-ray on site as well, but I wouldn't diagnose you with an X-ray. However, it is a very good tool to then correlate that to the examination, because it does paint a clear picture. Because an X-ray wouldn't lie. If you haven't been taking care of your spine, it will show. But I simply correlate that to the examination instead of solely using it to diagnose you. Does that would make sense? On that second day, you come back and I explain everything to you. Like I said, the main goal with this entire thing is for you to get a better understanding as to what's happening. Because if you understand what's happening, then the treatment is simple. The biggest issue with fibromyalgia is that people don't know what's happening. There's no cause to this, they say. But there is a cause. We just need to find it. And if we go over that, we go over the posture scans, we go over the x-rays, we go over the entire examination, so you understand what's happening. And then I can go over the plan as to how to get the body back in shape. What that's going to look like, I have no clue. Everything's individualized. I'll need to get my hands and actually assess you to know exactly what's happening to the body. Okay? Usually that 2-day process is 2 half-an-hour appointments. Including all the written reports, the time with us, and the x-rays, it can add up to around £220. However, we want to make this accessible for you guys, because I know how important it is to learn about your body. Because my mom didn't have the opportunity, we didn't come from a very privileged background, so her only opportunity was to the NHS. And if money wasn't an issue, she'd likely want to get another way of getting out of that. Each and